Welcome to Signature Required. It is intended for Tennesseans by Tennesseans. The heart of a Tennessean, the volunteer state, is serve, and we do so largely without self-promotion.
And these are genuine people that get up every day and want to make art, or want to educate the nations, or want to have a heart of love in a way that makes a difference.
Learn from 50 years of experience, take a nugget away, and then go share it with a friend. Lauren Clanton, behavioral health nurse practitioner at the Faith Family Medical Center. Welcome to Signature Required.
Thank you so much for having me.
We're excited to have you today. We're going to learn all about what you do here and the really important role that you play in the community. Tell us what you do. Where are we sitting right now? Some of our listeners are watching, but some are just listening. So we're not in our normal studio where we record a lot of our content. So tell us where we're at.
So we are in the Journey to Wellness wing at Faith Family Medical Center. And this area, we have a teaching kitchen. We have our dietitian is here, and our community health worker / chaplain is here. And so this is where we get to do a lot of nutrition, like teaching classes. We do yoga here. But yeah, this is a great place. We have our meetings here. So kind of a multi-use space here at Faith Family Medical Center.
What does Faith Family Medical Center do? If you're driving down, I was laughing driving here to meet you. Across the street is where we had all our kiddos, right?
Me
and so
too.
I haven't been back in the medical center really since I've had babies. That's not most people's experience. A lot of people have to be here that don't want to. So what do you do? What's your unique niche right here in this giant medical center area?
Yeah, so Faith Family Medical Center is a nonprofit healthcare center, and we are really geared towards taking care of, we say, our hardworking neighbors in need. So you think people like servers and musicians and landscapers and subcontractors where they may not be offered health insurance by their employer. So they're, and they may be living on a pretty tight budget. And so they can come here, they can pay a sliding scale, and they can see a primary care provider. They can have their lab work done, and that's covered by their copay, their sliding scale copay. We can help them get prescriptions through patient assistance programs because we have a pharmacist here. We don't have a filling pharmacy, like our pharmacy doesn't fill medicines, but we do patient assistance work, and so we help them get, their insulin if they need it for an affordable or even free rate. I'm here. I'm the psychiatric nurse practitioner here. We have a nutritionist, and all of our patients can see our nutritionist. And then we have several volunteer specialists here. So we have a cardiologist, we have an orthopedist that comes weekly. He's retired and does a wonderful job with our patients. We have we have two gynecologists that both come for a half a day per week, and they do a wonderful job. And then we have, like I said, cardiology, endocrine, neurosurgery. They'll kind of come every month for a half day. And then ophthalmology also comes when we have our diabetes day. And diabetes day and hypertension day are what we call our chronic disease days. And we get anybody in our population of patients that has diabetes or hypertension is invited once a year to attend a free visit. They don't even pay their copay. And they get to see everybody in the clinic for kind of not all the specialists, but they see their primary, they do labs, they see the nutritionist, we do a stress station, and so they get an ophthalmology exam if they're diabetic. So.
It sounds like from your demographic of individuals coming in, you're targeting individuals to serve that probably don't have health insurance. Is that right?
Yeah, so primarily they don't have health insurance. We also see what we call underinsured individuals. So underinsured patients are people that may work, again, they live on a pretty tight budget, but they've got like that high deductible plan where it would still be really out of their budget to go to the doctor on a regular basis, or especially to pay for blood work, routine blood work. And so it may not be something that they could feasibly do without help from us here. And these are the people that don't qualify for TennCare, like for Medicaid. They don't qualify for Medicare. They're not old enough. So we see patients that have commercial insurance here sometimes if they have a high deductible plan, or they do have to meet an income cap, and that's 400% or less over the federal poverty line. And that's if they have insurance. Now, if it's an uninsured individual, those individuals don't have to meet any sort of a income cap. There's not really a scale for that. But everybody who comes in does pay something. They pay anywhere from $25 to $65 depending on their income. And students, we also see full-time students. And so full-time students are only $30 per visit too.
So it sounds to me like you're trying to fill the holes that maybe, I mean, when you look at the government system and all of the aid available, there's inevitably going to be these pockets, right, where people make too much but don't qualify for X but still need help, or make nothing and don't qualify for Y. So is that a good representation? You're trying to kind of find the people that are falling through the cracks and make sure they have what they need. Does that sound right?
Yeah. We like to say we're filling the gap between, Medicaid and Medicare.
Okay.
Because there are so many people that don't qualify for Medicaid or TennCare here in Tennessee, and they, but they still need help paying for their health care, or they just, again, they may even have insurance, but that high deductible plan limits them from getting those routine labs that could, be that preventative key to diagnosing them early with prediabetes and helping them change their lifestyle. And so there's just so many ways that we are trying to really just fill that gap.
Can you give us some idea of the scope? Like, how many people do you see? We hear you have all of these services. I would imagine a lot more people come through these doors than we would even guess.
Yeah, so we have 6 primary care PAs and nurse practitioners, and then we have 1 medical director, Dr. Panovec. And so of all of those, usually, because some people work part-time, some people work full-time, of all of those, I would say about 4 or 5 are seeing patients daily, so 4 or 5 out of the 7. And so, gosh, I would say we're seeing anywhere from, usually it's about 80 patients or so a day, and that can sometimes include, the people that I see too. So I'm the only psychiatric provider here. And so, so I see anywhere from 8 to 10 patients on a full day. One of the great things about being here and, filling that gap for insurance and, not working under the arm of insurance or the schedule of insurance, I guess you could say, is that we do get to spend a little longer with our patients. We have some flexibility in how long we can take with patients. So our new patients we see for an hour, and our schedule or our established patients we see for 30 minutes typically. So that does allow us to really be able to give them the time that they need and get a full idea of their needs, because a lot of these people that we see, when we first see them, they may have not had health care in years, whether it be psychiatric health care or physical health care. So there's a lot sometimes to uncover, especially in that first visit, because we see people who just haven't gotten to go to the doctor because they can't afford it.
Part of the mission statement that you talked about earlier is that it's hardworking individuals and that they all pay something. And so can you talk about why that's important?
Well, because I think our demographic, again, we're really filling that gap between the people that could qualify for TennCare and those people that are old enough to qualify for Medicare. So primarily our patient population is of the ages of 18 to 64, generally. We occasionally will see kids or older adults who don't qualify for Medicare or TennCare for some reason, but that's pretty rare. And so this is like, the hardworking population. And so I think them paying something, I believe, when Faith Family was first founded, it was talked about how much should patients pay or should we have patients pay, and we're a little different from a free clinic. There are clinics where patients can go if they need completely free health care, or if they're, unable to work for some reason and get help getting on, disability or TennCare or whatever they need. But this is a different population that often gets forgotten because it is that they sometimes make too much to qualify for certain things. But I think too, from a psychological standpoint, it helps to know that you've got some skin in the game.
Yeah.
If you pay to come in, you're going to want to follow through and follow up more likely than if it's just a free visit.
Carly and I's background is in the logistics and transportation space, and I think the demographic that you serve is very consistent with the types of delivery drivers and that industry that we've spent so long in. And our experience in that space has been that the individuals wait until it's time for emergency room. And it's that crisis moment. You go to the emergency room, still without health insurance, and you come out with a 5-figure bill. And it is a financial outcome that literally sets them back years, if not pushes them into a place of collections. Their credit score is destroyed. Like things can snowball quick. Yeah, bankruptcy, all of those different things. So it sounds like part of the strategy here is to make care available before it gets to that crisis moment. Like how is that process even marketed? Because when I think about our employees, usually they're not looking for health care until it's an emergency.
Yeah.
Until they really, really need it.
Until they really need it. Yeah.
Yeah.
So how does that process unfold?
Well, I mean, we really are. That is one of our main goals, is to keep this patient population out of the emergency room. And a lot of the emergency rooms nearby are appreciative that we can help patients avoid that bill or avoid that, visit over and over again just because they can't get their blood pressure under control, when really it could be a simple primary care visit with a medication adjustment. So that is one of our main, I think, outcomes, is that we do reduce the uninsured patients in the area that have to go to the emergency room for care. It's not to say that our patients never have to go to the emergency room. There are cases that they do, and we do work closely with the hospitals nearby when that needs to happen. But we are really focused on that preventive care, and that just has been so unattainable for this population historically, because it's like, well, I could pay to go for a doctor's visit, or I could pay for my meal, or I could pay for a new pair of shoes for myself or my child, so it's like, it's just been hard, I think, for them to justify in the past if it's going to be hundreds of dollars instead of $25 to go for a preventative visit.
I'm curious too. It sounds like you do a really good job with your sliding scale of trying to make this accessible for anybody that would need to come in. How do y'all keep your doors open? All you read about healthcare is how expensive it is and the ballooning costs. And you listed off probably 10 different specialists that are coming in here regularly to serve. So what magic have you unlocked that other people haven't access to keep your doors open?
Well, Faith Family is, it's a pretty magical place, I will have to say. Like, I worked in healthcare for, about 10 years here in Nashville before I knew about Faith Family. And so I'm so grateful to be here now and to be working here. So we definitely are always continuing to try to get the word out and to do a better job letting people know, that we are here and we're here to help. But I think one of the biggest ways, that we get to keep our doors open is through, we have a lot of private donors that have donated and have supported us, where it may be churches, it may be endowment funds, it may be trusts, it may be individuals, it may be some of the nearby healthcare organizations that do donate to us. For example, Centennial Medical Center donates the lab work to us, and that helps us, but that does actually help them too, because it does help there to be less of that ER traffic that may be preventative care, really. So we're very grateful for all of our donors. About 70%, I believe, of our funding comes from private donors. So that is, the copay is a very small percentage of what keeps our doors open. And then we're also funded, we're not federally funded, but we are funded by the state through something called Safety Net. So when we see a patient and they pay that copay and we document that we've seen that patient and bill the service, we're not billing insurance, so it's a different kind of billing. It's just, documentation and letting everybody know that we've seen the patient. Then the state will reimburse us for a certain portion of that. It's a small portion, so it's not enough to where that and the copay could ever keep our doors open, but it is a little bit, and it does help in addition to the donations that we get.
So let's talk about your specialty some in psychiatric care. So just walk us through some of the history of, I could imagine sitting in, the medical field with every choice out there to say, I could go do this, I could go do this. Now I could choose some that I know that I wouldn't want to do, and I could choose some that I know I would never be capable of doing. But walk us through that moment when you're looking at everything that you could do. What influenced you to go down this pathway?
So I actually initially did my training as an adult and geriatric nurse practitioner. So I graduated from Vanderbilt in 2012 with my adult and geriatric NP, and went and worked in the nursing home area. And then I ended up working at the psychiatric hospital as a primary care nurse practitioner. So I was doing the medical history and physicals for the psychiatrist. When the patient would come in, we would have to get their medical history and physical within 24 hours to make sure that they were okay to stay. And if they had diabetes, I would manage their insulin. I would manage their blood pressure medicines if they had high blood pressure. If they had anything while they were in there, because we were not connected to a hospital. I worked out in Madison, at Skyline Madison, and we were not connected to a hospital. If they had anything from a hangnail to a heart attack, I would come and if I was on call,
that's a broad spectrum.
Have you used that line before? That's a classic line for you, isn't it?
They would call us, me or the other nurse practitioner that was on call, and we would come and take a look at the patient for just a quick visit and see if they needed to be sent back out to the hospital or if it was something we could stabilize them for in-house. And so I did that for about 3-4 years, and then I decided I was working 7 on, 7 off, and I decided I'd really, like to have...
What does that mean, 7 on, 7 off?
So 7 days on, 7 days off. Okay. So I would work 84 hours in 7 days, kind of about sometimes 12-hour shifts for 7 days in a row. And then I would have 7 off, which was great in theory, but I kind of like the traditional schedule a little more. So
wow, yeah. Probably for the first 3 days off, you're dead for 3 days. And it's
and if I, that was well before I had a family. So that would have been really difficult to manage with young children at home. But yeah, so I ended up working in more traditional primary care from, 8 to 5 schedule. And so I left the hospital setting and went into the outpatient primary care setting. And I would say it was really in the outpatient primary care setting where I saw so much more of a need for outpatient psychiatric care. I saw so much anxiety, so much depression, ADHD, and even some untreated bipolar disorder. It was just... And it was so hard to manage that along with everybody's diabetes, high blood pressure, high cholesterol in a 15-minute visit. And it was just, and I think that's something that every primary care provider struggles with. And so having had that experience, I decided that right before the pandemic hit, actually, it was 2019, I decided, I am going to just go back and get my psychiatric nurse practitioner certification. I really want to focus on this because I think coming from the background of working in the psychiatric hospital, I had a lot of psychiatric patients that I ended up seeing in that primary care setting, or maybe I just recognized it more or something and just wanted to spend more time with it. But I did enjoy treating it. I just didn't feel like I had adequate time, and I felt like I wanted more training. So I went back and did that while I was working, and actually ended up having a baby, deferring the program for a year, and then when I went back, it was the start of the COVID pandemic, and I had a toddler, and then I was pregnant, and then finished the program somehow. But it was wonderful. I mean, I worked part-time and did the program part-time, and it was a good experience.
That does not sound wonderful. Like, not to push back, but it sounds wonderful that it's over.
That's
like,
what
you
I
get
mean.
to say
that I was
you
able
did
to do
that.
it. Yeah, it was wonderful that I was able to finish it, but it was tough. And so I did that, and I was like, I really would like to focus just on psychiatric care and really focus on this one system, because I just want to be able to be a part of, one little part of helping, people that need psychiatric care in the outpatient setting get it. Because again, it's about prevention. It's preventing that hospital stay. Because when I worked in the psychiatric hospital, I saw so many people that were hospitalized. They got out, they couldn't get the outpatient care that they need to continue their meds, and so they ended up right back in. And it was like a revolving door. And it's just like the emergency room situation. Like, if you get your blood pressure managed for, a 14 to 30 day script of blood pressure medicine, when you run out and you don't have a primary care provider to go to, where do you have to go?
It does seem, when you think about healthcare, everything feels like it's kind of in its own bucket, right? Like, if your heart is bumming you out, you go over here, right? And if you have diabetes, you go over here. And I think mental health is treated that way too. It's, if you've got an issue there, you got to go see those people, which is you.
Yeah.
You got to go see those people. And my guess is it so informs every other type of illness, because
Absolutely.
I mean, you're the expert, but help me understand. I would imagine when you're struggling with your mental health, whether it be chemical, whether it be experiential, all the spectrum of that, I would imagine that manifests in your body in such a way that they are more prone to illness and other issues too.
Absolutely. And that's why I am grateful that I took the path that I did, that I was able to do primary care for a time before going back and getting my psychiatric nurse practitioner certification and just focusing on psychiatric care, because I feel like I am able to kind of make that connection a little bit better through my experiences and through my treatment of primary care and now into psychiatric care. But I also feel like this is a really wonderful place in that we have primary care providers, or I have primary care providers in the same building. And so I get referrals from the primary care providers to see a patient. It's not like it's not through a fax. I get a referral, I can go down the hall and talk to them about the patient, or say they want to start somebody on an antidepressant or a mood stabilizer that they see first, but, that patient maybe can't wait the 3-4 weeks to get in with me. So they get them started and they consult me on what would I start, and we go through, like, I was on my way out yesterday and one of the PAs was like, okay, what can I give this patient? I started him on fluoxetine. He's having sexual side effects. He's got diabetes. And so I was like, does he have high blood pressure? We talked about that. And then I gave her an idea of another medication that would potentially be less likely to have sexual side effects. And so it's like, and we can just have those quick conversations. And I've never really worked anywhere like that before, where I think all of us are under one roof. And I've always wanted that. And so I'm really grateful to be in that position now where, even our gynecologists, we can ask them if we've got, a question. In fact, it's also connected that I was in the room with one of our gynecologists for a patient with chronic pelvic pain the other day, because it truly is. The brain is an organ, just like your stomach, just like your heart, just like your lungs. And I tell patients that all the time who are a little bit nervous to take anything for psychiatric illness because of the stigma, or because it's just kind of, it's the only system that we can't, I can't palpate your brain and say, hey, you've got depression. So it's hard to conceptualize sometimes.
Lauren, I heard you say a second ago that sometimes people have a 3 or 4 week wait to see you. And I could imagine in your shoes that you see a lot of cases that are desperately sad, things that if you could just be with them, you could help get them on the right pathway. But there's an inability to help everybody every day, all the time. And I just wonder how you balance those things, knowing that you and the skill set that you have will meaningfully set someone on the pathway to health, but you just don't get to see them all every day. You can't. You don't have the time in the day. So how do you balance that? Because I just could imagine sitting in your seat, like maybe it's just, having too much of a heart, but like I just would be like, if they need to see me, I will be here until I run out of people that need the help today, right? But that's not sustainable. So how do you balance that, being someone that could help so many people, but you're only human?
Absolutely. I mean, I think boundaries are one thing that's gotten easier to set over time the longer I've been in healthcare. And sometimes it's still hard. But I will say, it is really comforting, again, that I am not, even though I might be the only psychiatric nurse practitioner here, I'm not the only person here that can help get patients started on medicine. And so we just take such a teamwork approach here that I feel like, every nurse practitioner, physician's assistant, Dr. Panovec, our medical director, like I said, we can talk very easily through the day. And so if that person can't get in with me right away, I think that we do a really good job at fostering that communication to get that person on what they need to start on and get them, referred to a counselor, because we don't have a counselor in-house, but we do have like a network of counselors that we refer to that also do sliding scale. Referred to community resources. We have an awesome resource here. I'm pointing this way because Beto's office is back here, but Roberto Santiago, or Beto, he is our chaplain, our community, and he's also a certified community health worker. So he is a really great resource that can do some spiritual counseling with our patients. Now, he's not like a licensed professional counselor or licensed clinical social worker, but he does spiritual counseling with patients. He also can meet them where they are in the community. Like, if we have patients that have trouble getting transportation here, he will find out what that issue is and see if there's a way that we can make that happen. Should we set up a virtual visit, or should we try to schedule them at a different time? So I think we just lean on each other a lot in this setting particularly, and we're really lucky to be able to do that.
Lauren, can you talk about the intentionality of it being the Faith Family Medical Center? Yeah. Is there intentionality behind having faith first as part of the name and the mission here?
Faith is definitely the root of what we do here. And the people that founded Faith Family, the physicians that founded it, were inspired by their faith to help those that were underserved, to help an underserved population, to help a vulnerable population that couldn't otherwise get care. But we do want to make it clear to everyone in the community that just because we are Faith Family Medical Center, we are going to see everyone from any faith background. We do not discriminate against who we see. Anyone can come and see us and get care from us. Yes, we are rooted in our faith, and faith has a lot to do with the way that we give care, and even, faith inspires us to have hope and to have courage to give care every day, and to trust that we are going to be supported financially to be able to give care. And a lot of the people that give us financial resources to be able to continue the care that we can here are churches, and faith-based organizations. But just the fact that we are Faith Family doesn't mean that we, have any specific faiths that we serve and don't serve. We are here and we are open for everyone.
Can you talk a minute about the chaplain role here? I think that's a really interesting aspect. And maybe just as a part of that, if you can dive some into the answer that you treat as much spiritually as anything too. Can you just talk about that? Because I think that's unique in especially the psychiatric space.
Yeah, I am very grateful to be able to have Roberto Santiago here. He is a very valuable resource to many of my patients. I would say one thing I don't think we have mentioned is that about 50% of our patient population is Spanish speaking. So about half the patients that walk through our doors are Spanish speaking, and many of those people do not speak English at all and have, we need an interpreter. I will say I am a minority that I do not speak Spanish. I need to be learning it. I want to learn it. Many of our providers speak Spanish and are able to see patients without an interpreter, but Beto is a great interpreter for me, and it's not only interpretation, though, when he comes and does the visits with me with a Spanish-speaking patient. Again, he knows those community resources so well. For example, if we have a patient who's here and they're from Guatemala, he might say, hey, I know a Guatemalan that is at this church. You need to connect with this person in the community. And so he just has those things. He just has this Rolodex that he in his mind, and he's able to access it. He also, we pray with patients. If we ask patients if we can pray with them, we pray with them. We are trying to instill hope, I think, especially in them when they're mentally down, because it is hard. And so prayer is a big part of that for us. And they get spiritual counseling through Beto, and he really is a good resource for them to lean on. And he calls patients and checks on them. Mm-hmm. He's not just going to see them once and not follow up unless they do. He's pretty good. He'll call you if you're not at your appointment and say, hey, where are you? Why aren't you here?
Will you talk for a minute further about praying with patients? Because I just think this is such an important aspect of medical care, is that there's one aspect of just addressing the presenting symptom and prescribing. But when you offer to pray for patients, how many, did you say 80% say yes, 50% say yes, like almost all? Like, have you had people say, no, you can't pray for me?
I don't think I've had, but it is super rare when someone says no. Uh-huh. Yeah. It is, most everyone will welcome a prayer. And I think it's really powerful in those moments. Like, there are things that people come to me with that medicine is not the answer, and I always tell people, medicine is never the only thing that's going to fix something, and medicine alone is not going to fix everything either, So I think that it's just really powerful in those moments when people are sharing, real trauma, and it's sometimes hard, even as a mental health professional, to know what the best treatment would be initially. So we stop, we pause, we pray, and then we kind of talk through, what kind of counseling might we be able to look into, how can we further unpack this and help you? A lot of times it's something grief related, how can we help you process your grief in a healthy way? So I think the prayer is as good of a pause, not only for the patient, but also for us as the provider sometimes when we are, when we need a little help and a little hope.
As I'm reading the stats about Faith Family Medical Center, it's astounding, really. So you guys see over 10,000 patients per year. As you're going into your 25th anniversary next year, you're seeing 10,000 patients per year. You're seeing patients from over 40 counties in the state each year. And 40% of your patients report behavioral health needs, highlighting your integrated services, how they're not just here for one thing. They're here for kind of a menu of things. And you're busy, and there's a lot going on, and there's a lot in the numbers. But I wonder, are there any stories that you could share with us about your patients or how they've impacted you? Because the numbers are great, but I'd love to know the heart behind it.
Absolutely. Yeah. I feel like, patients often teach me things. I am, yes, I might be the psychiatric nurse practitioner, but it's amazing that, sometimes it's really eye-opening when I talk to patients, how much they teach with their stories and their experiences. I would just say one of the main people that I think of with Faith Family and just how we have come together as a community to treat patients. I have a patient who I've seen for probably about a year now, and I actually see him and his wife, and they both are seen by primary care for multiple chronic issues, and they've really struggled the last year. They've had to file bankruptcy. He's having trouble working due to his mental health. She's kind of carrying the bulk of the the income for the household. They have an adult son living in their home who, is also disabled, not able to work much. I think he's able to do little things. And so I think would be really easy in that situation to just be like, I'm sorry, I can't help you, because we've had to try multiple medicines. We've had several, he's had to follow up pretty regularly, both with me and with primary care for multiple things. But it was really touching, this past Christmas, he came in and was just telling me about how part of his electricity in his house was out. And I think something had happened and some type of animal had chewed a wire. And so part of the electricity was out. And it was, of course, cold outside and that kind of thing. And so, we all were able to come together. And this was not like our donors. This was not anybody from the external community, but this was our staff. And we were able to put together a Christmas basket for this family and present it to him. And it was, Walmart gift cards for, where he gets his medication, because that's another barrier that a lot of our patients face. But even he was having trouble at this point, like filling his generic medicines, because without insurance, some generics are not cheap. It's kind of crazy. There's really not a great $4 list anymore. Like that's a thing of the past. And there's not a lot of meds that are free, no matter what the insurance or, without insurance especially. So, paying for multiple meds, even if they're just $10, $15 a month, that was a stressor for this family. So it was just really a blessing that we could have, present this to him and his wife and give them a little comfort in this time of need. And they still see us as patients, and we're still, helping care for them. And like I said, they've recently filed for bankruptcy, and he is in the process of filing for disability so that he can get some income. And he is getting better. It's just been a process, and I think it just speaks volumes of the way that we care for patients, not only with their chief complaint, their presenting problem, but we're really like trying to figure out what they need to improve their quality of life. And so I'm grateful to be a part of a community where we can do that.
I just think it's special, all those details. It just shows, it speaks to the amount of time you get to spend with these families, how deep you go with them, how comprehensive. I would imagine there's a lot of caregivers out there that would love to have that knowledge, and they just don't have the time or the ability in their practice to do it. And that really is special.
Yeah, it is special. And like I said, I'm very grateful for that time that we get with people. And it's one of the things that I think really separates Faith Family from other places where I've practiced. And
Lauren, in 2023, almost 10% of Tennesseans did not have health insurance, which is basically 700,000 people that are not covered. And Faith Family is trying to be innovative in ways to be able to deliver care and reach people all across the state. So one of the programs that I've heard about is Health Pass.
Yes.
And so can you take a minute to just talk about that and hopefully educate our audience that very well could benefit from exactly what you're about to describe?
So Health Pass is kind of another way that patients come to our clinic. Employers can purchase a Health Pass plan for their employees. And it's important to say Health Pass is not a replacement for insurance. It's not insurance, but it does give patients access to all of the services here at Faith Family. So it allows them to see us for primary care. They can see me. They can see our nutritionist. They can get lab work done. They can see our specialists, all of those things. But how it works is there's a few different plans. The main standard plan is about $38 a month. And either the employer can pay that all for each employee who wants to be on the Health Pass plan, or the employer could say pay $20 of it and the employee pay the other half monthly. The really neat thing though about Health Pass is that those patients get to come see us for an even lower rate. They can come see us for $10 a visit. So if their employer is taking care of the full Health Pass plan, they're just paying $10 every time they come in here, and they're getting their lab work done. They're getting their primary care visit. They might be getting, coming to our cooking class or getting nutrition counseling. They might be coming for visits with me. And, sometimes I'll see patients and then I'll have to see them back in a month if I'm starting a new medication for follow-up. And I might have to do that a few times, when I'm starting something new and getting it titrated up. And so having to pay $10 a month versus 25 to 65, depending on where they fall on that scale, can really help some of those people. So we've got businesses in the area. They're usually smaller businesses who otherwise, purchasing a full insurance plan for those patients, or for not patients, but for those employees would be not feasible due to the size of the business. So some of the community organizations here, the Fanny Battle Day Home, the Woodmont Christian Church Preschool, my church preschool, they use Health Pass. And then we have a few other preschools actually that are in there. We have one of the Southern Landscapes, several of the landscaping places, or other small businesses that, again, they might just have 10 employees that they buy Health Pass for monthly, or they may just have 3 or 4. Compost Nashville is one and they can come and see us for $10 and get full access. So it just brings those employees access to preventative care when they wouldn't necessarily have it otherwise. So,
and you did mention you have telehealth services too. We haven't touched on that.
Yeah, we do. Yeah. So, and that is something that we have been, I use that quite a bit just as a behavioral health provider because, again, I'm not palpating the brain, when I'm checking people or doing visits with people. So yeah, it is sometimes easier to do like a psychiatric follow-up via telehealth because it's, we serve people, what do you say, 40? I think it's 40 counties, in the surrounding.
And they're busy. They're working more than full time.
They're working, there's traffic, there's, it's one of those things where I think telehealth sometimes increases access, and that's our goal, And we have some patients that can't drive or don't have a car or who are new to the country and are afraid to drive. We have all kinds of patients that, for whatever reason, getting here every time they need to come in is not feasible for them. So I think telehealth is a really important tool, and it's not, appropriate for every type of visit, but sometimes for follow-ups, especially with me, it can be a really great tool.
Lauren, the way that we wrap up each podcast is I have 3 short fill-in-the-blank phrases for you to give a word or a short phrase at the end when I read it. All right. Number 1, when a patient walks through our doors, we want them to feel blank.
When a patient walks through our doors, we want them to feel heard and seen.
Number 2, faith transforms healthcare by blank.
Faith transforms healthcare by connecting the mental, the spiritual, the physical, and the emotional aspects of our health.
That's really come through today. I think that's outstanding. And the last one, with a magic wand, the one thing I would change about Tennessee healthcare is blank.
With a magic wand, the one thing I would change about Tennessee healthcare is more access to preventative healthcare. And I think, we are helping with a little piece of that here, but I think that could be so much bigger. So that's really what I would change, specifically preventative healthcare for mental health, just since that's what I do.
Mm-hmm. Lauren, this has been a really good time to get to learn about Faith Family Medical Center and the work that you all are doing here. It's very strategic, and that's something that Carly and I really love to see in the people and the organizations that we get to interview is that there is a clear understanding of who you're serving and who you're not serving. I think there's a unapologetic offering that is very intentional about the time that you spend with these individuals and the expectation that they are going to have some skin in the game and that they are going to be working. And I think those things are clear. And it's why you all are going to be celebrating 25 years next year, in that you've had a good mission. You also have a sustainable mission. And I think that's powerful. So we really appreciate you being here. Thank you for what you're doing for this community and for our state.
Thank you so much.
Lauren Clanton, nurse practitioner for Faith Family Medical Center. Her heart really shows through in her answers. And I think that's rare in the medical space, not because there isn't a heart there, but because of the pressure of the industry that, similar to lawyers, like you're only as good as your billable hour quantity.
Yeah.
And I think there's a lot of pressure on the medical space that you're only as good as your patient throughput.
Yeah.
And the intentionality of her choosing to be here and how much she could recount stories of the people that she sees, even though she sees a lot of patients, I think is a really great example of this place's mission working in the way that it's intended.
I'm just really impressed by how much they offer in one place. I mean, I think I was in cardiology, gynecology, nurse practitioners for regular GP visits. She works in psychiatric help. Like, they're also doing cooking classes. She said we didn't even touch on all of that. Nutrition, they can outsource you to different counselors if that's what you need that are on sliding scale. I'm just excited that we are here, that people get to know this exists, because I didn't know this existed. And as small business owners, we have felt that pinch, right? There were seasons where we couldn't afford to keep the lights on or keep our drivers in trucks and pay for healthcare, right? And so what we wouldn't have given to know that something like this existed in our community that could serve our employees. Because I think a lot of small business owners are in that rock and a hard place, right? Like, you care for your employees. You don't get very far if you don't care and take care of your employees, but you also want to keep being able to employ them. And those expenses could make that be in jeopardy. And so I love what they're doing here and who they're serving and why.